I'm pulling my weight in gold. Got me anxious, got me broke, but I can't live this on my own.
Welcome back to Ergo. I am your host, Brandon, here in Ohio. We're going to jump right into things today. I know that there's been a lot of heat regarding Trump-Russia connections, but we will cover that on next week's episode. We're going to wait to cover that until next week because I believe this entire Trump-Russia situation has caused us all to forget about the death-promoting American Health Care Act that just passed the House of Representatives. So let's get started. I want to start this topic or this segment by saying that I'm going to be trying something new for this episode, in the fact that I'm not going to be reading so much from my teleprompter as I'm going to try to be the person that I am. I feel like I'm a robot sometimes when I'm sitting here just reading the script that I do write, but when I'm reading the script, I feel like it's taking the whole emotional aspect out of the show. So that way, by doing it this way, I will give you the best product that I can give you. I want to start by giving you guys a little bit of context before we get into the content. So if you see me looking down a lot, I have my talking points in front of me, and I constantly need to remind myself of what I want to say to get all the information to you guys. So let's get started. Health insurance basically works like a bet or a poker game, if you will. The health insurance companies are betting us, the consumers, the customers, that they're going to make more money off of us being on their insurance plan over time. Now, they get money from us each month or out of each paycheck that we receive if we have employer-based insurance through what is called a premium. A premium is that monthly or amount that we pay out of each check to the insurance companies. And we pay that to them regardless of whether we actually use the insurance to go see the doctor, to get a shot, to go to the emergency room or anything. It's like car insurance. We pay into it each month. In turn, the insurance companies pay a portion of the healthcare expenses that we incur when we are going to the doctor, when we are going to the hospital, when we're getting shots, when we're taking our kids somewhere. They only pay a portion of it. It is a substantial portion compared to us paying that amount out of pocket, but it is still only a portion. Some insurance plans are called coverages also. So there's this big umbrella of insurance plans, and under each insurance plan are different smaller umbrellas that you would consider are coverages. Some coverages come with a principle that's called a deductible. A deductible is an agreement between the customer and the insurance company that says that the insurance company is not going to pay anything until we paid a certain amount out of our own pockets. So to put that into perspective, when I was with a different job of mine that I had before, I had a health insurance plan that had a $3,000 deductible, which meant out of all of my appointments, eye doctor's visits, anything that I needed to get done health-wise was coming completely out of my pocket until I had met the $3,000 mark, and then the health insurance would start paying their portions or however much percent that they were going to pay. So in order for premiums and deductibles and costs of healthcare insurance to remain low or even work at all, we all must pay into it. We all pay into this big pot, whether it's Anthem, whether it's Aetna, whether it's Humana, whether it's Medicare. So the health insurance companies take that pot of money and they pay their portion of our expenses. So if you never get sick, for example, you never go to the doctor, you never get an immunization, you never go to the hospital for any reason, and you're still paying your premium, your monthly premium, the amount that comes out of each check if you have employer-based insurance. If you never go to the doctor or use that insurance, you're essentially paying for other people to use their doctor to go to the immunizations, because it's all coming out of one big pot of money. So now we're going to move into the content part of it, okay? Shockingly enough, believe it or not, the Affordable Care Act and Obamacare are the exact same thing, which is where the Obama administration truly dropped the ball because people didn't understand that the Affordable Care Act was Obamacare. They thought that they were two separate entities. But we're going to call the Affordable Care Act the ACA for short, and I want to review with you what exactly the ACA does. First and foremost, the ACA invokes a principle that's called community rating. And what community rating is a requirement that forces health insurance companies to charge everybody the same amount in their premiums or in their deductibles across the board. Before community rating was enacted, the healthcare insurance companies were able to charge people with pre-existing conditions up to 5 times the amount of a healthy or normal person. Pre-existing conditions are things that include diabetes, hypertension, arthritis, heart diseases, obesity. It's a litany of things that were considered to be pre-existing conditions. In addition to doing away with that, charging people extra for pre-existing conditions, the Affordable Care Act allows children to stay on their parents' health care insurance until the age of 26 years old, which is a really good thing because everyone in America, not everybody, does not make it so far by the age of 18 to where they're established and on their own and can get their own healthcare insurance. Society doesn't work like that anymore. The ACA also got 20 million previously uninsured people insurance. And it did that by expanding Medicaid, and it did it by invoking what's called the individual mandate on all the Americans. Some of you may be familiar with the individual mandate if you ever filed taxes and you didn't have health insurance over a certain period during that previous year. Because if you didn't, then you would have to pay a penalty, the individual mandate, which was whatever amount it was. I'm sorry, I can't report to you exactly what that number is, but you would have to pay that amount to the government as a penalty for not having health insurance. Because remember, I just stated that in order for health insurance costs to remain low and in order for it to work at all, we all have to pay into the insurance pot. Okay? So, now we're going to move on to the controversial American Health Care Act. The American Health Care Act is something we're going to call the AHCA for short. The American Health Care Act was composed by the government Republican Party, and it was composed pretty much completely by the Speaker of the House of Representatives, Paul Ryan, whom is an individual that I completely detest, and I'm going to tell you exactly why. The AHCA is a product that the Republicans came up with after nearly 10 years of campaigning on repeal and replace Obamacare, repeal and replace Obamacare. They just kept bombarding us with that slogan over and over and over. They never had a replacement until now. So this is what the AHCA does. Number one, the AHCA removes that individual mandate or tax penalty that we all have to pay if we don't have health insurance. So some people might view that as a good thing. But if you're not paying into the pot, remember, if you're not paying into the pot, that's going to cause insurance costs to increase. Starting in 2019, no one, no matter what your income or poverty line level is, will be able to be added to Medicaid, because the Medicaid expansion that the Affordable Care Act enacted will be done away with. It's going to be wiped out, completely trashed, and removed. Okay? Currently, Medicaid is paid to each state based on the amount of people that are enrolled on Medicaid. So if in Ohio we have, let's say, I'm making up a number, this is not the accurate number, but say we have 200,000 people on Medicaid in Ohio, and somewhere like Rhode Island only has 10,000 people. Ohio's going to get more money for Medicaid because we have more people enrolled on it than does Rhode Island. What the AHCA, the Republican bill, is moving to do is to change the way Medicaid is going to be paid out. So instead of paying based on the amount of people that have Medicaid, is going to change that payment system to be in lump sums, a set lump sum. So what does that do, if you're wondering, and if you're even following me with what I'm saying? By changing Medicaid from paying based on the amount of people on it to doing block grants or lump sums, that is going to make it harder for states to keep people on Medicaid because it's only going to pay a set amount. So in turn, that also forces states to kick people off of Medicaid, not allow anyone else to join Medicaid whatsoever, because there will only be a set amount that we will receive in Medicaid in each of the states. The AHCA also removes the tax subsidies, mainly from the tax mandates that we have now. It removes those subsidies that pay the insurance companies that participate in Obamacare. It removes it. It does it away with. So if you take that and add it to the fact that we're cutting Medicaid overall, that equals an amount somewhere around $880 billion with a B. So what does the Republicans plan to do with that $880 billion that they're going to have in a surplus? What they're going to do with that is they're going to offer tax cuts to the top 1% of wealthy people. And I'm not making that up. You cannot make it up. You can look it up if you don't believe me. My reporting in today's episode comes from Vox.com. I did my research on this to make sure I knew what I was talking about. So if the government keeps that $880 billion, that's just money that the government has. So if they save this $880 billion and offer massive tax cuts to the wealthy, that's how they're going to do it, because now they're saving this $880 billion. Do you get what I'm saying? So, most controversially, the AHCA is going to allow states to opt out of that principle from the Affordable Care Act that's called community rating. That states that insurance companies can't charge more for people with pre-existing conditions. This new bill, the American Health Care Act, is going to do away with that and allow states to opt out of it. So now the healthcare insurance companies in states that opt out are going to be able to charge significantly more for people with pre-existing conditions. Here's the list of pre-existing conditions, and it's a very overwhelming list, but I want you to note some of the things that I feel are petty, but some of the things that they are now including as pre-existing conditions that can get you charged more. Notice the highlighted ones that include pregnancy. They want to be able to charge families, men and women, for people that are going to get pregnant or are pregnant. They want to charge them more. Mental disorders is a pre-existing condition under this new bill. Paralysis, transsexualism, acne, and simply being overweight. If this passes into law, your health insurance costs, your premiums that you pay out of each check, or every month, however you pay your premiums, is going to get jacked up, in addition to those other items that are not highlighted on this picture. So, you would expect a lot of Americans to be very, very angry and pissed off about it. I am, and I know that a lot of people are. There have been protests across the country. So, this is how the Republican Party is justifying this tax cut and enacting these pre-existing conditions. They say that they're going to only allow the states to opt out and charge you more for pre-existing conditions if and only if that state enables something that's called a high-risk pool. A high-risk pool is basically a market of people with pre-existing conditions, and they have to pay into their own separate pot of insurance money, separate from the healthy people. And then to help curb the people who can't pay into that high-risk pool insurance pot of money, the government is planning to set aside $8 billion to allow the states to help the people pay for those high-risk pools. However, it has been recommended from several state and federal government agencies that the amount for high-risk pools that would be needed would be $25 billion. 25 is the recommended amount, and the Republicans are only going to put aside $8 billion. Very troubling. And what I find to be the most heart-wrenching, most selfish, most egregious thing that this healthcare bill that they're looking to pass is going to do is it's going to cut all things that are essential to health insurance and to the everyday lives of Americans. That's probably why they're called essential health benefits. Here are the things that the American Health Care Act is going to allow insurance companies to stop providing unless we pay more for it. That means get ready to say goodbye to outpatient care, emergency services, hospitalizations, pregnancy and maternity care, newborn care, mental health and substance abuse disorder services, prescription drug coverages, physical, occupational, speech rehab therapy, and device coverages. So that means no more walkers, no more wheelchairs. You're going to have to start paying more for that. Lab services for if you go get a complete blood count or any type of blood work done, that's going to be more. Preventive and wellness services. And then what is most critical and disgusting to me is they're going to allow the insurance companies to stop overall pediatric care, including oral and vision care. I truly just don't know what to make out of all of this. The moral compass, this is me speaking completely personally and giving my opinion on the story. The moral compass of these people has to be just abysmal, because this is literally going to kill millions of people. In fact, the last time the Congressional Budget Office did an evaluation of this bill, it said that 24 million people are going to lose their health insurance by 2026. That's shocking, and it's scary to think of all those people that are going to lose their insurance. Hell, I could even be one of them. And it just doesn't sit well with me, and it shouldn't sit well with anyone. No matter how rich you are, no matter how much money you make, it's truly, 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 grossly immoral and wrong. Let's consider some of the pros of this American Health Care Act, to be fair to the conservatives and to the Republicans. One of the pros or beneficial things of it is that everybody who's rich is going to get a tax cut. Literally, that's the only good thing that I can pick out of this disaster of a health insurance plan. The cons, or everything that's negative about it, is pretty much everything that it states other than the tax cuts for the rich. This bill is so bad that so many organizations have come up and advocated against it. Here's the list of them. Some of them include the American Medical Association, the American Hospital Association, the AARP, the American Nurses Association, thankfully, because I'm a nurse, agreed that this is terrible, and they've come out against it. Even the Breitbart blog, which is known to be very conservative and very Republican, has come up against this. So speaking as a professional and as a nurse, I will say that the Affordable Care Act has its problems, and those problems need to be addressed. They need to be fixed. I've worked as a case manager, I've worked as a floor nurse, I've worked as a director of nursing. And I can say that the Affordable Care Act has caused several problems. It causes patients to be discharged from rehab facilities way before they need to be. It causes these almost impossible to meet regulations for healthcare facilities. It pays pretty much next to nothing to the healthcare facilities that provide care to people. So it certainly has its problems. In addition to, the premiums are rising under Obamacare, and there are a lot of counties in a lot of different states that don't even have an insurer participating in the Obamacare exchanges. So yes, it does have its problems, it does have its defeats. But as a nurse, I can truly tell you that this bill right here is going to destroy lives. It's going to destroy people. It's even going to destroy careers, hospitals, nursing homes, you name it. It's going to truly gut our entire healthcare system across the board. I personally just can't stand for that. And no one should be standing for that. It's incredible. I'm truly at a loss of words that they even got this past the House. I want to remind everybody that this isn't the first time that they voted on this. In fact, the first time that they voted on it, it didn't have enough votes, so they pulled the vote. Because there are some Republicans out there who are saying absolutely no, this is a disaster, and thank you to them. The second time, still not enough votes. This third time, they got enough votes to get it passed through the House of Representatives at the pressure and behest of Donald Trump. It's almost as if the lower class, lower income Americans this bill just basically says that you don't deserve to live if you don't make a certain amount of money. Remarkable at the very least. So what do you guys think of it? I want you to let me know. Please tweet me, email me, leave me a comment, come on the show, do anything that you want to do. But the fact that this bill got worse and worse each time is just astounding. It only has a 17% approval rating amongst the U.S. citizens. So we need to come together as a people. I can't belabor that issue enough. And then to celebrate it, the Republicans went out to the White House in the Rose Garden and had a beer party to celebrate it, seen in this picture right here. Now, some Republicans did their job, and despite the backlash that they knew they'd face, some of them still did their jobs and held town hall meetings with their constituents, and most of them turned out like this.
You are mandating people on Medicaid except dying. You are making a mandate.
No one wants anybody to die. You know, that line is so indefensible. Nobody dies because they don't have access to health care.
Meanwhile, the majority of Republican congressmen refused to do their jobs, and instead of holding town halls with their constituents, many of them took the lead from House Speaker Paul Ryan, whom held no town halls. But instead, he went to the media to lie and spread propaganda known as gaslighting about his healthcare bill seen here.
With you. Second of all, let's remember what's happening right now. Obamacare is collapsing. Obamacare isn't working. What good is Obamacare for anybody, let alone a person with pre-existing conditions, if you don't have a health insurance plan that you can even get? So this is a rescue mission to make sure that we can achieve the goals we all want, which is getting the cost of coverage down and making sure that everyone has access to affordable health care, especially and including people with pre-existing conditions. That is what our bill does.
Well, let me just...
So there's your healthcare wrap up. Hopefully you're as disgusted as I am. But after the break, in the next segment, we're going to set the tone early for the 2018 midterm elections. Ergo wants to be the platform for you to express your political thoughts. Please feel free to join the discussion via phone, video, or in person. To set up an interview, contact The Ergo Show at Outlook.com. All right, so currently in the House of Representatives, there are 238 Republican members. There's 193 Democrat members. So if you ever hear me or someone on the news say the Republicans have the House, the Republicans are in control of the House, that is because there is an overwhelming majority of Republicans in the House of Representatives than there are Democrats. Okay? There are 4 vacancies, 4 open seats in the House of Representatives right now, and that is due to some of those representatives being appointed to other positions or retiring or resigning. I do know that one of them, Mick Mulvaney, who is now the budget manager, Office of Budget Management person, his seat is now open as well. But overall, in the House of Representatives, there is a total of 435 available seats. So normally, to pass anything in the House, you have to have a 218 count vote, because that would be the majority, more than half of the House of Representatives. However, currently, since there are only 431 members due to the 4 vacancies, there only needs to be 216 votes to pass anything from the House of Representatives, which is why that disastrous American Health Care Act passed with only 217 votes. They were just too shy, from not passing it. But I'm not going to continue to belabor that issue because I'm going to get very upset again. On November 6th of 2018, please remember that date. Please. That is the day where midterm elections will happen. Midterm elections are elections for Congress that are usually held right in the middle, in between the president's 4-year term. On November 6, 2018, all 435 seats of the House of Representatives will be up for re-election. So in order for the Democrats to take over the House, rightfully so, in order for the Democrats to take over the House, they need to keep all of their current seats and take at least 25 seats from currently Republican-held House of Representatives, which is not difficult to do, especially considering the fact that all 435 seats are open and a lot of people are very hot, very angry about the Republicans passing this healthcare bill. But we can't do it if we don't vote. So I can sit here and belabor the issue, and talk about how treacherous this is. But until we all get up and go vote on midterm elections that usually have a very, very low turnout, this year there's too much on the line for us to have another low turnout. Now, in the United States Senate, which is known as the upper chamber of Congress, there are only 100 seats, okay? Currently, there are 46 Democrats, 52 Republicans, and 2 independents. Now, those 2 independents usually caucus or agree with everything the Democrats do. So you could technically, in most cases, count it as 48 Democrats and 52 Republicans. But they don't always vote with the Democrats, so you can't necessarily say that. So this essentially means that the Republicans have the majority, have the Senate. Okay? This year in 2017, there are 4 Republican seats that are going to be up for election and 1 Democrat seat. Overall, if you take those seats and combine them with midterm elections that are going to be held again November 6, 2018, there are a total of 33 seats that will be up for election. Now, the reason why every seat in the House of Representatives will be open is because they are only on 2-year terms. So when they get elected, they're in for 2 years and then they're up for re-election. However, there are only 33 open senator seats or Senate seats because they're on 6-year terms. So the stakes are very much higher on whoever gets elected. Now, 23 of those 33 seats that will be open are Democrat seats. 10 are Republican seats. So, this is kind of an uphill battle in the Senate, if you catch my drift. So with that said, to keep their for the Democrats to take the Senate, they will need to keep their current amount of 46 seats. So whatever that number is they need to keep the 23 seats that will be up for re-election, and they will need to win 5 seats from Republicans. Or the other strategy is this. If the Democrats could win 3 seats and the 2 independents that are also up for re-election, if they keep their seats and continue to caucus with the Democrats or vote the way the Democrats vote, then the Democrats will take over the Senate as well. This is a very, 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 very uphill battle, if I'm going to be quite frank with you, and that is because there's so little Republican seats that are up for re-election. And there's this principle, or this practice, I should say, that the Republicans do that's called, and the Democrats are guilty of it as well, to be fair, the Democrats do it too, but it's called gerrymandering. And basically, if you take a United States map, pick a state, for example, Ohio, and they draw the districts. And they draw the districts of a state to be beneficial to that party. So they'll try to gather all the people who identify as Democrat and draw them off into a district. So yeah, you can get 1 Democrat. But then they'll draw all the other districts to be majority Republican voters. So that way, obviously, there will be more Republican senators or Republican House of Representative members. That principle is called gerrymandering. And if it gets too extreme, then the courts get involved and they strike it down. But in most cases, they don't get struck down, which is where the issue is. So there's a big uphill battle. But moving back into the Senate overall, because I'm going off into a stray, the Senate, in order to pass anything from the Senate that will become a law, requires 60 votes, which the Republicans, thank God, do not have. But there's a caveat to that. There's this practice or rule in the Senate that's called budget reconciliation. And what that does is there are certain limits on a law that the Republicans can come up with to where they will only need to pass it with a simple majority of 51 votes. And remember, they have 52 currently sitting Republican senators. So, what are we going to do, America? That's the question of the hour. That's the question of the year. That's the question of pretty much our remaining days in this Donald Trump's current term. Something's got to be done. There's so much at stake. Like the very, very hot and bothering Trump-Russia connection, which we'll get into in next week's episode. But as long as the Republicans are in charge, from what they're showing us and what their behavior is, Donald Trump's going to get to do whatever he wants to do. And the Republicans aren't going to have anything much to say about it at all. So the Democrats must take either the House of Representatives, the Senate, or both. Something's got to get done here. Something has to get done here. Anyway, so the Health Care Act is just nothing more, like I was telling you before, besides a full dressed up tax cut. The Republicans are showing their clear desire to drag their feet on the Kremlin Klan investigation, like I said, and they're putting their party before their country. They're also putting their desperations to maintain power at the forefront. The Democrats must take control of the House and Senate, or at least one, as I said. I cannot urge you, the people, enough to get out and vote. The time for complaining is over. The time for rejecting the election has passed, and it is now time to take action. We can use our harsh words and attack each other, and we can attack the government officials all day, but what's the outcome? We only win when we take action. The Republican Party is an opposition party implicitly by design. America is supposed to be a progressive nation that even Republicans say needs to move forward. But we can't move forward when the Republican Party that is the majority and has control is unwilling to come along with the rest of us, unwilling to face the facts, and they are stubbornly obstructing justice. This is by no means an attack on those who identify with the Republican Party, in as much as it is an attack on those whom are representing the Republicans in being irresponsible. I cannot sit idly, and I will not watch and ignore these blatant derelictions of duty. When we return, we will close today's episode in the final segment I've come to conclude. Ergo wants to be the platform for you to express your political thoughts. Please feel free to join the discussion via phone, video, or in person. To set up an interview, contact The Ergo Show at Outlook.com. The point of making the choice to run for an elected position is a desire or want to serve the public, because government officials indeed serve and represent the public. So while taking the behavior of our government officials into consideration, one can't help but beg the question, why the hell did these Republicans run for office? Yes, they all state that their ideologies or ideas are to benefit the American people, but very few of them can say that their actions meet those statements. And both parties are guilty of serving special interests over public needs, Democrats and Republicans, and they're both guilty of putting their party before their country. In today's polarized government and society, the left-oriented liberals and right-oriented conservatives are acting as legal yet disorganized gangs, quick to point the finger, and even quicker to hide the hand that threw the stone. When the Republicans obtained the majority in the House of Representatives and in the Senate, they obstructed every single thing that former President Barack Obama attempted to do. Now that Donald is holding America hostage, the Democrats are testing the theory that two wrongs don't make a right, as they are now obstructing everything that they can concerning Donald. But from my point of view, that is the right thing to do. Let's consider all the things that the Republicans have let Donald get away with. Firing the FBI Director James Comey. FBI investigation of Donald Trump dating back to July 2016. The Kushner family selling immigration visas in China, but only if the Chinese investors would invest in their real estate project here in New York. Accused Nazi Sebastian Gorka is working as a White House aide. Donald refusing to release the White House visitor logs. And government agencies like the State Department advertising Donald's golf course in Mar-a-Lago as a vacation in the Southern White House on their official government website, which is expressly forbidden. It would behoove anyone to agree with me when I say that had this been former President Barack Obama or former Secretary of State Hillary Clinton, they both would have been impeached for far less. We will cover the Kremlin Klan and my view of Republican behavior in next week's episode. But for now, this concludes this week's episode of Ergo. Before you, the people.
I'm pulling my weight.